All right, what's up, guys? Welcome to Diabetes Talk. I'm your host, Charlie O'Connell. We are broadcasting live from the GLUCOSEZONE studio here in New Haven, Connecticut. I'm so grateful and thankful to be with you tonight on this winter blizzard, polar vortex, bomb cyclone, whatever you want to call it. I'm happy that you guys are here with us, that we are safe. We are live, on YouTube. We are live on Instagram. I see you guys. And guys, we are live on Facebook also, direct from my Facebook page today. So, first off, I want to do a huge shout out to a couple people. I want to do a shout out to Hajikandia Samasa. I love that name. Thank you so much for joining us. Hajikandia, let me know where are you logging in from. And Jeanette, guys, Jeanette has been kicking diabetes butt with GLUCOSEZONE now. We got an amazing video from Jeanette showing us how she's been kicking diabetes butt, and it's great to have you here, Jeanette. And we've got several people on Instagram joining us, including, Shefri Monnikai. Shefri Monnikai, I see you on Instagram joining us from California. It is great to have you here, guys. Okay, so tonight's topic, guys, is I have pre-diabetes. What does that mean? So what we are really going to break down for you guys tonight, is what is pre-diabetes? How do you get diagnosed with pre-diabetes? What is the difference between pre-diabetes and type 2 diabetes? And basically just give you some very, very practical explanations as to what does the actual diagnosis of pre-diabetes mean, number one, and very practical solutions. How can you get rid of pre-diabetes? So the first thing is, what actually is pre-diabetes? So pre-diabetes is elevated blood sugar levels, that are above normal but are not as high as to be considered type 2 diabetes. So, let me actually really break this down for you guys. There are 5 kinds of diabetes. There's type 1 diabetes, type 2 diabetes, pre-diabetes, gestational diabetes, something called type 1.5 diabetes. There's also something called MODY diabetes, which MODY diabetes generally falls into the category of type 1.5 diabetes. And also LADA diabetes. So there are actually very, very many different types of diabetes, but all of them have the same thing in common. They all have one common denominator, and that's why they fall into this category of diabetes. And what the common denominator is elevated blood sugar levels. So diabetes is a disease of elevated blood sugar levels. Now, why are elevated blood sugar levels bad for you? Elevated blood sugar levels are bad for you because blood glucose molecules, are shaped like shards of glass. And I'm going to give you a really easy analogy to understand why elevated blood sugar levels are bad for you. And I want you to ask yourself, have you ever put sugar in your coffee or tea before? And everybody has done that at some point. So what happens when you put the perfect amount of sugar into your coffee? What happens to the sugar? The sugar dissolves, and you drink the coffee. You can taste the sweetness of the sugar, but there is no actual physical remnant of the sugar. Now, what happens when you put too much sugar in your coffee? When you take the last sip, what happens? You can actually feel the granules of sugar on the tip of your tongue. All right. It turns out that if you took a microscope and you compared a granule of table sugar to a molecule of blood glucose, geometrically they're exactly the same shape. And they're both shaped like shards of glass. Sharp, jagged, pointy edge objects. Now what I want you to do I want you to take your fingernail and I want you to start scratching your forearm. Okay? Literally, just start scratching your forearm. And I want you to notice immediately what's happening to your forearm. What's happening to the skin on your forearm? It's starting to get irritated. What would happen if you just kept scratching your forearm? What would happen to the skin? Eventually, the skin would get irritated enough that it would break. Okay. If you can understand those simple analogies, okay, then you can understand why elevated blood sugar levels are bad for you. If you have molecules of blood sugar that are shaped like shards of glass, circulating through your body at elevated levels, they start to scrape against the inside of your blood vessels. And if they continue to scrape, eventually they'll damage your blood vessels from the inside out. And that is what the actual complications of diabetes are from. The damaging of the inside of blood vessels by shards of sugar. Okay, so very important, guys, that you understand why are elevated blood sugar levels bad for you. Okay, now let me just stop right there. We've got a ton of people on the line that I want to shout out. I want to shout out Daisy, Lauren, Frank. I see you guys on Instagram. It is great to have you here. Erica from El Paso, Texas. I see you. Okay, and everybody else, guys, that's joining us on YouTube and Facebook. It's great to have you here. Now, Pablo, Andrew. All right, hold on. I got to shout out a whole bunch of people here on Facebook. Pablo, Andrew, Tiffany, Liz, okay? Kelly Sika, it is great to see you here on Facebook, okay? Seeing a lot of friends and family, guys, and people that have been involved with GLUCOSEZONE from the very, very beginning. It is great to have you here. All right, now, getting back to this diagnosis of prediabetes. So, that's step number one, understanding why elevated blood sugar levels are bad for you. Okay, now, many healthcare professionals think that calling it prediabetes is actually a disservice to people that have prediabetes because people tend to take it less seriously, okay? But the reality is there really is nothing about prediabetes. If you have elevated blood sugar levels and you don't do anything about it, that is eventually going to really start to damage your blood vessels, okay? All right, now, the second thing is defining the actual diagnosis. So, the way that you are diagnosed, okay, with prediabetes is one of 3 tests, and I'm going to really break down each one of these tests. The first one is called an A1C test, all right? Now, if you have an A1C of between 5.7 and 6.4, you are considered to have prediabetes, okay? If you have an A1C of 6.4 or above, that means you have full-blown diabetes, all right? Now, let me explain to you exactly what the A1C test is, okay? Technically, the A1C test is called the hemoglobin A1C test, and it's expressed as a percentage, all right? So the number 5.7 to 6.4 is a percentage number. Now, what is it a percent of? All right. What the A1C test actually is an examination of your red blood cells. And what is examined is the glycation and scarification on the red blood cell caused by shards of sugar. So literally, what they do is they go in and examine and they look at a red blood cell and they look at it and they say, what percent of this red blood cell has been glycated or scarified by glucose molecules. And it's expressed as a percentage. So if you have an A1C of 5%, 5.0, that means that 5% of the red blood cell had glycation on it. If you have an A1C of 10, that means that 10% of the red blood cell had scarification and glycation on it. Okay? So, an A1C of 5.7 to 6.4, in other words, 5.7% to 6.4% of the red blood cell, of the hemoglobin, that means that 5.7 to 6.4% of the cell itself had glycation and scarification on it from glucose molecules. So that is what the A1C test is, okay? And that's why it's expressed as a percentage. Okay, that's very, very important to know. You know what? There are so many people that basically they get the A1C test, they know that they basically know that it's not good, but they don't actually know what it represents. And I want to encourage you guys, okay? Anytime you go to the doctors and they give you back a report and it has information on it that you don't understand, I want you to go and figure out what it means. It's so important. And in this age of Google and Wikipedia, and YouTube, if you want to find out, if you want to find some information, you can find it. If you don't understand it, then you should talk to your doctor or come join us in the GlucoSezone. Guys, a lot of what we do here is actually explain to people what these terms and definitions mean, okay? Okay, so that is what an A1C is. And if your A1C is between 5.7 and 6.4, that means you have pre-diabetes. If it's 6.4 or above, that means you have diabetes. If it's below 5.7, that means you don't have diabetes, okay? And I want to encourage every single person that is here in the GlucoSezone with us, if you get your A1C down below 5.7, you will have reversed your type 2 diabetes, okay? And I want to encourage you, don't ever let anybody say that you can't do that, all right? Now, for people living with type 1, the metrics for success are a little bit different. And the reason why I'm saying that is sometimes people living with type 1 can really, really get caught up in getting their A1C down below 5.7. And that is amazing. If you have type 1 diabetes and you get your A1C down to 5.7 or below, that is a phenomenal job of managing your diabetes. But I don't want you to get discouraged, okay? The bottom line is, if you have type 1 diabetes and you can keep your A1C below 7, you dramatically reduce the risk of the complications associated with diabetes, those shards of sugar circulating through your blood. Now, an A1C of 7 is equal to a blood glucose level of 154. And that's a very important correlation that you should remember. An A1C of 7 is equal to a blood glucose level of 154. That is why, guys, if you're using the GlucoSezone app, we consider in the GlucoSezone a glucose level of 154 or below. Okay? All right, so that's the A1C. We've got a couple more people joining us. Chronically Healthy has joined us on Instagram. Okay, it is great to see you here. And we've also got Alex and JP in the house on Facebook. Guys, it is great to see you too. Some old friends going all the way back, guys, to high school days joining us tonight. And Gene Brooks in the house on Facebook. Gene, it is great to see you. All right, now, let's move on to the next test that can diagnose prediabetes. The next test that can diagnose prediabetes is something called a fasting plasma glucose test. All right? And this can be used to diagnose both prediabetes and or diabetes. And what this test measures is this test measures your blood glucose levels, okay, in an individual who has not eaten anything for at least 8 hours. So that's why it's called the fasting test. So usually the way that you do this is you take this first thing in the morning, okay, after overnight, you haven't had anything to eat for at least 8 hours. Now, a fasting plasma glucose level of between 100 and 125 indicates pre-diabetes, right? So that I'm going to say that again. A fasting plasma blood glucose level of between 100 and 125 indicates pre-diabetes. So what that means is if you have dinner tonight, you wake up the next morning, it's been 8 hours since you've had anything to eat, and you have a blood glucose of between 100 and 125, straight off the bat, that means that can indicate you have prediabetes. Now, if you have a fasting plasma glucose level of 126 or above, that's an indication that you have type 2 diabetes. Okay? So the fasting plasma glucose level is another way to determine if you have prediabetes or diabetes. Okay, now, we've got several great questions coming through YouTube. We've also got some new people who have joined us, so I want to acknowledge Maeve joining us from the Philippines. Maeve, it is great to have you here in the GLUCOSEZONE. Okay, I hope that the weather is nicer in the Philippines than it is here in New Haven. Okay? We've also got a question about triglycerides. Can you just pull that question back up? So there was a question about triglycerides, which is a really, really important question. So the question is, what is a triglyceride? All right. This is extremely important to understand, so I'm glad that you brought this up, Jeanette. Thank you. So when your body stores glucose into the parking lots, and remember guys, there are 4 parking lots for sugar in your body: your brain, your liver, your muscle, and your fat adipocyte tissue. Okay? So when your body, using insulin, stores glucose into your liver or your muscles, the storage of that glucose converts the glucose into glycogen. So when glucose gets stored in your liver or glucose gets stored in your muscles, it's stored as glycogen. When glucose gets stored in your adipocyte cells, which is your fat tissue, it's converted into and stored as triglycerides. Okay? And literally, it's a chain molecule that is a liquid, and it gets deposited into an adipocyte cell. And an adipocyte cell is literally like a receptor cup, okay, where a little tiny droplet of converted glucose is deposited. Okay? Now, I really want to encourage you, if you haven't heard me break down the parking lot analogy, I want you to look up and understand the parking lot analogy. But what you need to understand from a triglyceride perspective is the average human being has approximately 4 billion adipocyte cells, okay, in the body. And those 4 billion adipocyte cells, when they are filled up to the max, filled with triglycerides, that represents about 30 pounds worth of fat. Okay? Now, once those adipocyte cells have become full, and you still, right, are trying to deposit glucose into your fat cells, you become at risk for elevated triglycerides. And what elevated triglycerides are glucose that have been converted into triglycerides that are waiting to get into your fat cells. But there's no room in your fat parking lot. And I really want to encourage you, if you haven't heard me break down the parking lot, okay, I want you to really, really go look this up. But basically, guys, depending on your physiology, you may have a limited fat parking lot. And what that means is your fat parking lot is finite. You get to a certain amount of fat on your body, your fat cells swell to a certain amount, and when fat cells swell, that's called adipocyte hypertrophy. Okay? Hypertrophy means growth of the cell. Once your adipocyte hypertrophies to their maximum, there literally is no room for the triglyceride to be stored. Okay? Now, there's a difference between adipocyte hypertrophy and adipocyte hyperplasia. What adipocyte hyperplasia is the ability to create new adipocyte cells. And if somebody has adipocyte hyperplasia, that is how they can become extremely obese. And if you've ever seen that TV show, My 600-Pound Life, okay, people who weigh 600 or 700 or 800 pounds, they have a condition called adipocyte hyperplasia, which means that their body can just create and multiply more and more adipocyte cells. They're not limited to 4 billion adipocyte cells. That is how somebody can weigh 600 pounds and not have diabetes. Okay? So, that really can help. A lot of people get confused when they see somebody who weighs more than they do, but they don't have diabetes. Okay? You may be in the position where literally your body's fat parking lot just cannot store any more sugar. All right. Got another great question coming in. This is coming from Erica, and the question is, does pre-diabetic need medication? All right. So, Erica, that is a great question. Okay? And it really depends on the healthcare provider that you talk to. Now, if you go on the National Institute of Health, okay, and you look up what is the therapeutic remedy for prediabetes, it will say unequivocally increased physical activity and reduced caloric intake. Exercise more, eat less. That is the therapeutic solution for reversing prediabetes. Okay? Now, some healthcare providers will put patients who have prediabetes, will put them on a medication called metformin. Okay? Metformin is one of the oldest diabetes medications. And what metformin does is metformin inhibits your liver from secreting glucose back into the bloodstream. It inhibits hepatic secretion of glucose. Hepatic means liver. So what metformin literally does is it blocks up your liver parking lot. It makes it so that your liver cannot secrete stored glycogen back into the bloodstream as glucose. All right? And some healthcare providers will prescribe that medication for prediabetes because that'll definitely lower what metformin does. Metformin does not lower your blood sugar levels. What metformin does is it prevents your blood sugar levels from going up, okay, if your liver is secreting it out. All right, so it's a really, really good question, Erica. That is the medication that is usually prescribed for prediabetes. All right. Now, Dottie has joined us. Okay, Dottie, I'm glad that you joined us. Even though you didn't get the notification, that's what I'm talking about. Guys, okay, you can always know that we're going to be live at 7:30 doing diabetes talk. Okay, I also want to do a couple different shout outs. Lily has joined us. Lily, thank you so much for being here with us. Okay, Mark Bynum, Maria from California, Sean, Jessica. Guys, it is great to have you here on Facebook, okay? And I really, really enjoy getting your guys' questions. And Brian McCabe is in the house. Yes, Brian, it is good to see you. Now, okay, so the third test, guys, for diagnosing prediabetes is the oral glucose tolerance test. Now, the oral glucose tolerance test, okay, what that does is it measures blood glucose levels, okay, who have eaten basically a sugary drink, consumed a sugary drink, and then they test your blood sugar 1, 2, and 3 hours after the person has consumed the sugary drink, okay? And the results are as follows. If you have a blood sugar level of between 140 and 199 at the 2-hour mark after drinking this sugary drink, that means that you have prediabetes, okay? If you have a blood sugar of over 200 at the 2-hour mark, that means you have a blood sugar of, that means that you have type 2 diabetes, okay? So the oral glucose tolerance test, right? It is a literally a test where the person comes in, they drink a sugary drink, then 2 hours later, their blood glucose is tested. If the number is between 140 and 199, that means you have prediabetes. If it's above 200, that means you have type 2 diabetes. Okay? So those guys are the 3 tests that are used to diagnose prediabetes: the A1C test, the fasting plasma glucose test, and the oral glucose tolerance test. Now, there are 2 other ways that you can identify prediabetes, okay? And the first way is if the person develops dark patches of skin on the back of their neck, okay, inside the armpit or in the crease of the elbow or the knees. Okay, and what this is, basically what this is, if you see dark patchy skins, dark patches of skin on the back of the neck is usually the most kind of obvious to see. What that is literally is the storage of excess insulin. Okay? If you see somebody has dark patches of skin on the back of their neck or underneath their armpit, what that is literally the person has stored excess insulin in that place in their body. Now, we've been talking a lot about excess glucose. So let me just really break down excess insulin and clarify something. When you have something called insulin resistance, which is a common diagnosis for people with type 2 diabetes, that actually means you have too much insulin in your body. It's called hyperinsulinemia. Too much insulin in your body. And your cells have become resistant to the effects of the insulin, most likely because there is no room in the cell for the storage of glucose. Okay? When that excess insulin circulates around in your blood for a long enough time, your body will work to remove that excess insulin out of the blood, but it needs a place to put it. So it actually literally will create it as a storage. Okay? And that is what that dark patch of skin actually is. So if you see that on yourself, or if you see that on your partner or a friend or a family member, that's an indication that person may have prediabetes or diabetes. Okay? The last one is if you start to have your vision affected. Okay, your eyes are very, very sensitive to elevated blood sugar levels. And the reason why that is because your eyes are filled with very small capillaries, microcapillaries that are very susceptible to shards of sugar passing through them, simply because they're so small. Okay? All right. All right, so you know what, guys? We're going to wrap this up with Erica. Erica just shared with us that her doctor said she doesn't need medication, and if she only exercises, okay, she can beat this thing. And she just let us know that she's lost 10 pounds, and her A1C went from 5.7 down to 5.6. Erica, I am so proud of you, okay? That lets everybody here know that this is totally possible. It's a great way to end this diabetes talk. And guys, I'm so thankful for you guys joining this community. I love answering your questions. I love being able to share in this journey with you. You guys are awesome. We are going live tomorrow morning in the GlucoSezone app at 10 a.m. Guys, I cannot wait to see you there. And I want to do a huge shout out to everybody on Facebook who joined us also. YouTube, Facebook, Instagram, you guys are awesome. I will see you tomorrow morning in the GlucoSezone app. Have a great night.